Hello, I'm Luca Ferasin, one of the cardiologists here at the Ralph Veterinary Referral Center, and I'd like to share with you some information about coughing, because coughing is a very common clinical presentation in first opinion practice as well as in the referral setting. And I've been studying coughing for more than 20 years, and it's been one of my major interests in clinical research. And I've also been invited to speak worldwide about this topic, as well as writing book chapters. And obviously, I'm very happy to have been invited again for the second time in a row to write the chapter about coughing in the textbook of Veterinary Internal Medicine by Ettinger and colleagues. And one thing that very often carers do not understand, or perhaps they get confused with, is the fact that coughing is a very positive protective mechanism. So coughing is a reflex to maintain the airways free of potential dangerous materials, so avoiding the inhalation of something like foreign bodies or dust or bacteria that can cause serious complications at the level of the airways. So nature designed cough in a way that the inhalation of this material can trigger some coughing receptors, which are located in very strategic points along the airways. And this stimulation of coughing receptors will induce a very deep inspiration, followed by forceful expiration against the closed glottis. By doing that, the intrathoracic pressure increases quite dramatically, and then it's only when the glottis eventually opens that this air is expelled very rapidly within a sort of a explosive maneuver that pushes out everything that shouldn't enter the airways. And for this reason, we shouldn't actually be concerned about coughing. And that's true in probably 99% of cases. And the only time we should be concerned about coughing is when cough is so persistent and so severe that interferes with the quality of life of our pets. And this could be, for example, coughing that persists during night, so the pet cannot sleep, and very often the carers of these pets cannot sleep at the same time, because very often they sleep in the same room. Or when the cough is so persistent that interferes with eating or drinking, because these patients keep coughing so they can't actually swallow any water or food. Or when the cough interferes with exercise, or when the cough causes pain or discomfort. For all the other reasons, we shouldn't actually treat cough, because by inhibiting cough, we will inhibit the protective mechanism. So this is a very clear signal that we need to send to pets, carers, because very often they are over-concerned about this issue. So now, investigation of cough obviously is still very important, because if we determine the underlying cause of coughing, then we can, in the majority of cases, address the issue and limit the amount of cough in the frequency and severity of cough in these patients. And because of the distribution of coughing receptors, we know that cough is always caused by an airway disease. Because coughing receptors are located primarily at the level of the larynx and first trachea rings, and they are exquisitely mechanoreceptors, so they respond to mechanical stimulation, like, for example, a foreign body that presses on the wall of the larynx or the trachea, or even the bronchi. But as we go down the airways, the density of coughing receptors drops quite dramatically, to the point that at the level of the bronchi, for example, we've got less coughing receptors than compared to larynx and trachea. And then we go down on the level of the bronchioles, respiratory bronchioles, or alveolar wall. There are no coughing receptors at all, which means that it's impossible to stimulate cough for these areas. And a very common misconception is the cardiac cough. Cardiac cough has been taught to all of us at university, but in reality it's been quite clearly demonstrated that there is always an underlying airway disease causing cough, and perhaps with the cardiac disease, the increased size, if severe enough, of course, the increased size of the heart can contribute to the coughing by stimulating more coughing receptors simply by pressing on the airways that are passing above the cardiac silhouette. So it's never a primary cardiac condition. It could be just a a participation of a cardiac disease, but there must be an underlying airway disorder. So when we investigate cough, we should probably obviously consider a cardiac disease, but we should focus primarily on the status of the airways. Now, there are very common causes of cough in dogs, primarily small breed dogs, and I think that the most common condition is tracheal collapse and or bronchial collapse, and this is caused by a condition called tracheobronchomalacia, which means loss of strength of the tracheal or bronchial wall, which tends to collapse during the expiration because of the increased intrathoracic pressure. The wall of the bronchus trachea should be pretty rigid and should not deform within certain limits, should not deform during respiration. But with bronchial collapse and tracheal collapse, this can happen quite regularly. And this is the cause of a friction of the walls that collapse and irritation of the mucosa, where obviously we have cough receptors, and we end up with a cough in these patients. Another very common cause of coughing is kennel cough. Of course, that's by definition a laryngotracheitis, primarily of viral origin, but some Bordetella can be also an important agent in coughing patients. But again, this tends to be a self-limiting condition. Sometimes we treat with antibiotics, whether it's the right treatment or not, difficult to know. But as I said, viral conditions, as much as our winter cold or winter flu, tends to resolve spontaneously. So we shouldn't be over concerned about this type of cough. So perhaps observation initially and conservative management is what I normally recommend. And then obviously when we move to geriatric patients, in particular, we have as another common cause of cough, chronic bronchitis, which tends to be with a higher incidence in terriers or in dolichocephalic breeds, Labradors in particular, Cocker Spaniels, etc. These are all breeds that tend to be predisposed to chronic bronchitis. And then obviously we've got other causes of cough that are important, which are probably less commonly recognized, and one is called the postnasal drip syndrome. Now, postnasal drip syndrome is a very common cause of coughing in people, and is caused by a chronic rhinitis, rhinosinusitis, with percolation of the secretions that tend to be quite serous. So there's not thick mucus, it's a quite serious material that percolates from the choanine into the pharynx and can stimulate the larynx, where we got a high density of coughing receptors, as I mentioned earlier. So if you see a patient with clear nasal discharge and with sneezing and continuous swallowing, that could be an indication of postnasal drip syndrome and should be treated accordingly. And another common cause is irritation by irritants in the household, and we probably underestimate the importance of cigarette smoking, for example. And although the smoking habit is going down quite dramatically, fortunately for our own health, some dogs are still exposed to passive inhalation of smoke, and there is a very strong evidence that this smoke can be inhaled and nicotine can be absorbed. So we equally think that this can be sufficient to cause irritation of the airways and causing cough. But simply there are other environmental factors like excessive dust, for example, in the environment, or fragrances, plug-in perfumes, sprays. They can also trigger cough in our dogs and cats. Another cause of coughing, very commonly reported in people, but not so commonly reported in dogs, is the gastroesophageal reflux. So this is caused by, obviously, gastrointestinal disorder with movement of the gastric content into the cardia or distal part of the esophagus, and this can trigger coughing receptors that are located in these areas. Sometimes the reflux can come up to the pharynx and can also cause irritation of the larynx. But again, this is something that is commonly observed in people. We tend to observe it more and more commonly in dogs because we started recognizing it, and this is a cough that tends to respond simply to antacids. And then there are other causes of cough that are completely unknown in veterinary medicine because they've never been reported except for one or two references in textbooks. Is the use of ACE inhibitors. ACE inhibitors are obviously first-line treatment in the majority of cardiac diseases in dogs and cats, but they can also predispose to cough. This is not very commonly reported in dogs and cats, and probably not as common as it is in people, where approximately 25 to 30% of patients on ACE inhibitors complain about a dry, persistent cough. But if you have a patient with this cough that is not responding to treatment, and they are on ACE inhibitors, try to remove the ACE inhibitors for a couple of weeks and see whether the cough improves, because this is a cough that tends to start almost inevitably within a couple of hours from the administration of the tablet. But obviously we got a lot of other causes of cough. Some are quite severe, like the presence of a lung tumor that can compress on the airways by occupying the lesion in the chest. Because of the mass occupying lesions in the chest, and then we got allergies and so on. So the list is very long, but I'm trying just to give a sort of general gallery of possible causes. Now, when it comes to management, I always start with the 5 questions for the carers. Is the dog sleeping at night? Is the dog eating, drinking, exercising despite the cough? And furthermore, is the cough causing any discomfort? Because if the answer is no to these questions, we shouldn't really panic. We should take time to do a proper investigation, try to reduce perhaps the amount of coughing. But even when we cannot recognize with 100% certainty the cause of cough, we should probably consider a non-conservative, conservative management or non-pharmacological management, which consists on the use of a harness rather than a collar when the dog is walked on the lead. It's obviously less applicable to cats, but obviously if dogs have the tendency to pull on the lead, then the pressure caused by the collar on the larynx can stimulate the coffee receptors, making the condition worse. The other important thing to consider is the body condition score of the animal, because if the dog or the cat are overweight, they can predispose to cough, because excessive fat can accumulate in the chest as well as in the rest of the body. And obviously the chest has limited capacity of expansion, and this fat can contribute to the pressure of the airways causing coughing. And anecdotally, we say that if we can, in overweight patients, if we can reduce the body weight by 10%, we tend to achieve a good response in approximately 50% of dogs and cats. Then very important is the environmental conditions, so an assessment of the environment in the household, making sure that there is no cigarette smoke or excessive dust. I always recommend to avoid all perfumes and fragrances in the house, especially when they spray or plug in. And also I recommend to put clean cotton sheets on the dog bed or the cat bed, and wash them quite regularly, just to reduce the amount of dust mites that can also be responsible for cough in these patients. And then very important, I think this is one of the milestones of non-pharmacological management or conservative management, is the humidification of the environment, especially when cough is more commonly presented in winter. And the reason is that in winter, the central heating tends to dry the air, and that tends to dry also the mucosa in the airways. And sometimes simple humidification can provide a massive clinical improvement. And the reason is that inhalation of steam, or actually cool mist, which is what I normally recommend, can make the mucus, the mucous secretions, a little bit thinner, and that can be coughed up more easily, and also promote the activity of the mucociliary escalator. So this mucus can come to the pharynx and can be swallowed. So this way we clear the airways with a very simple environmental intervention. These cool mist ultrasound humidifiers are available in all health shops or online, and they don't cost very much. I would say probably 20 to 30 pounds, and they work beautifully, because the ultrasound break water producing this cool mist rather than a hot mist that can predispose to bacterial infection, and these particles are extremely tiny at the level of microns in terms of diameter. So these particles of water can reach very deep levels in the airways, and the response is pretty dramatic within a few weeks, although perhaps at the beginning we may see increased cough simply because the mucus become a little bit more fluid, so it's coughed up more frequently to start with, to settle down later on. And then if all these interventions for a few months fail to produce a sensible and satisfactory response, then we should probably consider inhalation steroids as an empiric treatment. Inhalation steroids are obviously very powerful because they are inhaled via the dedicated spacer, and they only act in the airways where it's needed without being absorbed. So the steroids that are not absorbed will not cause all the side effects we normally see with oral medication. So the tendency to eat more, for example, to put on weight, predisposition to iatrogenic Cushing, immune deficiency, and so on. So we can perhaps try oral steroids to start with, just to see what the effect will be, but then we need to consider long-term management with inhalation steroids. But obviously, if you want to be more proactive, we want to identify the cause, certainly chest radiograph would be always the very first step, because chest radiographs will always identify important lesions if they're present. So for example, we want to exclude the presence of a lung tumor in a geriatric dog, or we want to exclude the presence of a diffuse bronchial pattern in chronic bronchitis, or the narrowing of the airways in tracheobronchial malacia. And obviously, if the standard X-rays is not sufficient, sometimes we want to consider more advanced imaging like a thoracic CT scan. But in general, we tend to get our chest X-rays without any sedation, and just with a bit of patience, we can position the animal on the X-ray table. So dogs and cats tend to stay in position sufficient time to acquire a good quality chest X-ray. So it's not invasive. We don't need general anesthesia. We don't need anything that can obviously compromise the potentially compromise the status of the patient. And I would always not dissuade, but perhaps put a word of caution in the use of bronchoscopy, especially in very small dogs or in cats, because it's a pretty invasive technique. And bronchoscopy should be reserved to patients where we suspect, for example, a foreign body, so we need bronchoscopy to retrieve foreign body, or where all the other tests have failed to provide evidence of the underlying airway disease. So bronchoscopy is an important tool, but should become probably at the end of our investigation, as we do, or our general practitioners do with us in terms of human patients. Bronchoscopy is never the first line treatment. And so obviously the investigation and treatment of coughing is quite complex, but at the RALF we got all the available diagnostic tools and knowledge and expertise to assist your patients with this very common problem.